So I'm going to talk a little bit about what we're doing around people and some of our compassionate initiatives. So as part of an ongoing investment into training and development, we've commissioned a series of 10-minute skills booster workshops. So these videos include things like inclusion, leadership and teamwork. They're on Evolve. Please sign in and undertake them. They're part of our cultural programme to help us all work in a really great cultural environment and to really help value and support each other. There's access 24/7, as you know, to Evolve, so please log on and have a look and undertake some of them. So as you know, compassion is absolutely key to our role of providing excellent patient care. And there has been a really good, bespoke, compassionate project around what we've called cuddle pockets. So cuddle pockets help crews transport babies that have very sadly been lost or stillborn. And they are bespoke little pockets which are specially handmade and hand knitted by a charity and knitters, which enable baby to be held by the parents and for crews to convey baby and parents to hospital in a dignified and compassionate manner. There's a really sensitive and good good video, which you can have a look at, and the links are on the website. So please have a look at that. The team really led a great programme of work. They led all of the other ambulance services in this initiative, and I think it's an absolutely fantastic piece of work. The knitted pockets for babies of less than 24 weeks, and we've had feedback from parents, and they really help parents in what is really a very, very difficult and sad situation. So thank you. So coming on to our COVID vaccination programme. So the programme's up and running this week again. Absolutely delighted to see people coming in and getting their vaccines. So thank you very much. We had a really successful phase 1 of the programme. So we've had over 95% of our substantive staff take up a vaccine. So thank you to all of you. You are making a really big difference to protect yourselves, our patients and your families. So thank you. Please come in and get your second vaccine. And please, again, book on Evolve. There have been lots of talk about shortages of vaccine. So please be assured that we have got a good vaccine supply. So come in and get your vaccine, attend the clinics, and let's make sure that everybody gets their second jab. We've had over 6,000 staff vaccinated so far, so that's absolutely fantastic. Well done to everybody. Please book on Evolve, and please come and get your jab. So thanks very much. I'm going to hand back to Marcus, and then I'm really delighted to take any questions from people. Thank you very much.
Thanks, Julia. And I guess out of some difficult events, a good example of learning and sharing and improving our patient experience journey, and importantly came from the people involved with that incident. So really about listening and placing into action what is a very, very difficult time, both for the parents but also for anyone who attends as well. The other bit, I'd just pick up on the phase 2 vaccination. It's such positive news. It is really, really good. I'd just take the reminder, or take this opportunity to remind people that we still need to follow a number of the other initiatives in place, such as social distancing, the COVID secure, hand washing, face masks, making sure that we're still using lateral flow testing. The reality is, and I think I've spoken before on here, is the vaccination is a massive step forward in the country, and being able to look at an element of what a new normal would look like. But it doesn't mean COVID is over. it really doesn't, and therefore we still need to protect ourselves, protect our colleagues, protect our patients and our families. And by following all of this together, this gives us the best hope of being able to manage what's likely to be a difficult summer, actually, for us as an organisation, based around people staying on holiday in the UK, as well as we go into winter, but importantly about looking after yourselves at work. Mentioning about performance and touch, thank you all. So, and actually for everybody in the organisation who is doing what they are for our patients, and ultimately we are here to look after our communities, and we continue to do that really strongly. The support they're able to give in terms of our response to patients, our patient access targets. We know that from our latest round of ambulance quality indicators, we are giving good quality care in those as well, and that's really, really important, because it's been a difficult 18 months actually when you look back as an organisation on performance, but again, really, really positive. The other bit is about the progress related to where we are with special measures, and for us in our CQC report. So there will be a bit more come out tomorrow in terms of need to know, but again, we are well on our way with closing the actions associated with the CQC. Now, what does that mean? Well, it means we're closing a number of our process actions, a number of those things that will mean kind of something important to individuals involved in, say, ER casework, so employer relation casework. When we're closing the actions, what we're not doing though is we're not saying it's done, and again, really, really important. This for us is a journey. Closing some of the CQC elements were more around, I guess, our practical and our process and our I guess our people components, i.e. we're doing some bits within those. What's really important is, again, this becomes another journey for us in our whole improvement. When you step back, we know that we'll have some elements from the CQC we'll need to review and reflect about what the next stages mean. We know that there'll be other work, and I think from us, and you've heard when I've been on with John before, what we're not saying is it's all fixed and it's all perfect. So we absolutely know that there is still work to do. We know we still have as for those of you who are speaking up and speaking out, which is really important, really important. We know that in itself may create more casework, and we need to make sure that we are resourcing that, we are learning, and that's really kind of our important focus. From an executive perspective, we're absolutely still kind of working on those improvement plans, and also in terms of the work undertaken about that learning and sharing. I thank you all actually for those of you who are coming forward, those of you who are speaking out, and we are starting to see kind of people with some confidence that they can do that they can reach out, that they can have conversations, that we are able to, I guess, really start to learn, and ultimately, you know, a true belief that we do need to change, but we can change, and for us is to support people in that. Look, we are probably at a point where we are learning a lot, and that learning a lot, when we start to look back, particularly at some of our legacy casework, is some of those times that may feel uncomfortable for people, because we're now kind of asking some more challenging questions, or some of the areas of focus as we move forward as well. We can't shy away from that as a collective, nor should we, because if we are truly going to move us forward, then we really have to start getting at some of the root causes behind that, and that requires to have those conversations, those continuous conversations. And I guess a good example of that, if you step back and you look at the events related to Sarah Everard, and you think about what that means in terms of safety, security, you start to look at that in terms of how we support each other, how we keep each other safe. You know, we would encourage people that if you feel unsafe or you need to speak up, please do so related to that. We want everybody who comes to work to feel safe, and we want you to feel secure. There are a range of things within that, and a range of initiatives that we are looking at, but importantly, it's about how we support each other to do that. And if you feel individually a concern, that you do come forward on that. We will be looking at our lone worker policy. We've signed up and we'll be looking and rolling out a trial of body-worn video cameras across the trust. So there's a range of very practical things that we will be looking at doing as well. But again, using our freedom to speak up, speaking to your line manager, a colleague, just to talk about that, to talk about the concerns and how we build those as well, to work together really on those solutions, and to support you in the workplace, and for us all to support each other in the workplace as well.